I was working in reception and in walks this beautiful woman, smiling as she approached me. She told me that she'd like some teeth whitening as soon as possible because she's going to a wedding. Ugh, the bad breath that she had almost knocked me backwards. But as a professional, I tried to ignore it and have a good discussion with her about whitening. And we then booked her an appointment. 3 days later, Anna comes in for her appointment, dressed beautifully like she was the other day. Actually, I think she might be a model. Anyway, she starts talking to me and that bad breath almost made me jump back. However, I persevered and I gave her the forms and got her to go in the waiting room and to fill them out. When she was finished, I then asked her to accompany me back to the treatment room. She followed me back and I seated her in the dental chair, introduced her to the dentist and the dental assistant. Then I left. Now you might be wondering, who's this person telling me about dentistry? Well, my name is Lisa, and for those of you who are on Quora, Reddit, I'm also known as Lisa Limited. I've worked in many industries including fashion, e-retail, and I've been 15 years in dentistry. During that time in dentistry, I've seen many patients and they all want pretty white teeth. So not too far later, the dentist comes to find me to tell me what's happening with Anna. And as it would have it, it's horrendous. Her mouth is a complete mess. And yay me, I get to tell her. So I go and get her, we sit down in a consultation room. And I'm trying to come up with the words to convey how serious her condition actually is. I did ask her, has anyone ever told you that you have bad breath, or have you noticed that you have really bad breath? Because most people won't tell you that. They'll come talk to you and then they'll run away. So if you're dating or you're in that scene or you're single, you might want to make sure that you don't have bad breath because you'll be forcing them away from yourself. Anyway, I went on to tell her why she had bad breath. And it's because she had a really serious tooth infection, an abscess. She also had some cavities and she had lots of plaque all over her teeth. Now, at first she was alarmed, distressed, but then she just got dismissive. Like, oh, I'm just here for teeth whitening. What? Yeah. At this point, many dental offices would get out a waiver, say, well, you know all about your dental condition, so if you sign here, we'll do the whitening without taking care of that. Hey, win-win. Heck, the patient gets what they want, they get the teeth whitening. The dental clinic, yeah, that's $600 towards this month's sales target. Sound good? No. This is why you should not do that. You shouldn't go ahead with whitening. Spend the money on yourself before you spend the $600 on whitening. Your health is very important, and a tooth infection is serious. In some cases, it can even lead to death. So the other thing with teeth whitening is it causes tooth sensitivity and pain. Now, when you add to that mix an active tooth infection and lots of cavities, decaying teeth, the sensitivity and pain goes through the roof. So, get healthy. That's my advice to you. Take care of what's going on your mouth. Get rid of the infection. Take care of the cavities. And then whiten, because that whitening is going to make your smile pop. It's going to brighten your whole face, and it's going to take years off your age. So, here's my question to you. If this was you, what would you do? Would you sign a waiver and just get the teeth whitening done? Or if you're a dental clinic, what are you going to do? Are you going to get the patient to sign a waiver? Or are you going to educate and go into the patient's health? Be concerned. What I would really like, if you guys could leave me some comments. I'd really love to hear what you think about this. Now, currently I am the co-founder and manager of redpopo.com. It's an online platform where we make and sell health and beauty products. While I'm not currently in dentistry, my mission is to educate people from my experience. Now, I'm not a dentist, I'm not a physician, I'm not a licensed healthcare provider, but I've seen dentistry from both sides. And I want to let my experience count. I want to educate people, and if I can help just one, I'll consider my job done. So, how about it? You're going to help me educate? What I'd like you to do is to share my video. Share it, give me a thumbs up, like me. Okay, that's the best way to get my message out there. And if you want to hear more, my full blog on the story is available at redpopo.com.